So let's roll into the Keller Funnel.
Okay.
Share with us what it is and how does it work?
Well, the Keller Funnel, as I've said in blog entries before, and I tell people, is a device I wish I had invented. So my hat's off.
I have heard that actually from other physicians.
It's a beautiful device. My hat's off to Dr. Keller, who I've met personally and is a stand-up guy, and I give him a lot of credit for coming up with this device. I brought one along with me. Basically, and this is their second design, I should say, by the way. So they've actually improved their design. This is the KF2, or the second generation Keller Funnel that just came out, I think in April is when we started using this. It became available in April. It's made out of a clear PVC plastic. It used to be made out of nylon. And essentially what this is it's just like a cake baker's funnel that where they will squeeze icing on a cake. And what it does is it helps us to get the silicone gel implants in through smaller incisions. It helps prevent irregular forces, so tearing of the implant, fracturing of the gel is much less. And maybe more importantly, it helps avoid contact of the surgeon's hands or the patient's skin or nipple tissues with the implant. So it cuts down on contamination, which may lead to lower capsule contracture rates. There's some exciting data that may come out down the line that show that capsule contracture rate may be decreased by using the Keller Funnel. It hasn't been conclusively proven yet, but so I always tell people, even if that doesn't come to pass, there's still so many reasons I would use the funnel, even if the capsule contracture rates stay the same. I can take this funnel and pour the implant into it essentially without having to touch it with my hand. So right out of the sterile package that it comes in from the manufacturer, pour it into here, close that up like this so I don't even have to touch it. I insert this smaller end into the pocket like this, and I just squeeze down like that, and the implant slides right in.
Wow.
Textured implants go wonderfully with this new design of the Keller Funnel as well, so that even though there's more friction on the textured implant, they've improved the lubricant on the inside of this.
That's going to be my next question. I was going to ask if you had to put any kind of lubricant in with the implant as you squeeze it through.
It's already applied on here, and those guys have looked at that. That's been one of the hardest things for them, I think, in the design of this, and they've really got it down now so that this is working wonderfully, even when I put in the textured implant, shaped or round.
Well, that seems like a lot less aggressive approach for implanting an implant and putting in an implant. So I would think if I was a patient, I might want to ask my doctor if he actually used that device for implementation of an implant.
I agree with you. I would want to know that too, because I think we're going to probably see a day where the Keller Funnel is kind of standard procedure for putting in breast implants, because the old-fashioned way, as it were, was just that we would have, just manually insert the implant, and we'd have different ways of sort of working the implant in there. But as I said, that applies uneven forces. Sometimes on the tip of the surgeon's finger, the force would reach enough levels that it would tear the implant or fracture the gel inside. And then it's also dragging across that skin, which can drag contamination into the pocket and increase our risk of capsule contracture.
Wow, that's good to know. I love all this new technology coming out, making it easier and better for the patient and for you.
That's right.
That's good.